Do you think this new workforce plan will actually include any measures to address or even acknowledge the challenge of GP retention?
I mean, there's certainly a risk it won't go far enough to improve GP retention because, as that study we were talking about earlier pointed out, part of the solution, and possibly the most fundamental part of the solution, is more funding for general practice. Funding to make sure practices can afford to recruit and aren't pushed to keep cutting back on locums, on salaried GPs and other staff to stay afloat financially. I mean, that's the way that, tightening finances force practices to react. So, as we pointed out too, the government tends to talk about the GP workforce in terms of overall numbers. So if it can show that the overall number is going up, it may not feel the pressure to go further on retention. But there are obviously really big risks with that. The RCGP said a couple of years ago that a bold plan to improve GP retention is one of the single biggest steps the NHS can take to deliver rapid improvements in the ability of general practice to meet growing patient need and the requirements of the new government for the health service. As the study we talked about earlier suggested, experienced GPs are the backbone of general practice. So ignoring retention means allowing pressure on general practice to spiral, even though on paper GP numbers are rising. And experienced GPs are exactly the people needed to run neighbourhoods and to oversee the kinds of changes to primary care delivery that the government says it wants. So again, if NHS officials and the government ignore retention, it will almost certainly come back to bite them, and more importantly, patients, in various different ways.